Something we've been reporting, the number of measles cases, and it continues to skyrocket. Already more in 2025 than all of last year.
And not even 3 months in, we're marking the most infections nationwide in a single year since 2019. Joining us now to talk about it is Onondaga County Health Commissioner Dr. Katie Anderson. Always enjoy having you. Thanks so much for joining us tonight. Appreciate it. So a lot of the cases that are showing up are coming out of Texas and New Mexico. What's going on down there? Why is that the case?
Since late January of this year, there's been an evolving outbreak, starting out in Texas and now spreading to New Mexico. To date, there's been over 300 cases that have been confirmed. Unfortunately, 75% of those are in kids, 20% of those have been hospitalized, and 95% of all cases are in unvaccinated people. So it's an outbreak that's focused in unvaccinated people, which is typical. Sadly, this outbreak has also been associated with our first measles death in 10 years in the United States. And the first was in an unvaccinated child with no known other medical conditions, and there's also been a death in an adult. But as we're diving into this, it's probably helpful to talk a little bit about what is measles, so people know why we're concerned about it. It's an airborne virus, which means it spreads when you sneeze or cough, and it's highly contagious, which is one reason why these outbreaks are something that we really watch for and that can spread so quickly. If there's somebody with measles in a room with 10 people, 9 of those people, if they're unvaccinated, might end up with measles. Wow. Typically, it's a relatively mild infection with a high fever, rash, watery eyes, and cough. But as we're seeing in Texas, 20% of people can be hospitalized with it. The severe disease can cause pneumonia, brain swelling with permanent brain damage, and death can occur with measles as well. So it can be incredibly serious.
All of that you just shared, very concerning. How concerned should we be in upstate New York?
Fortunately, we've not had any cases in central New York in 2025. However, right now, measles cases aren't only happening in Texas and New Mexico. There have been cases in 10 other states in the U.S., and that includes New York. There's been a case in New York City and a case in Suffolk County. So we are on high alert as public health folks working in New York State. We know that our vaccination rates are relatively high here in central New York. Anywhere between 85 to 89% of 2-year-olds have gotten an MMR vaccine, but that's not high enough for measles. For something that is so contagious, 95% of kids will have had to get their vaccine to prevent the spread, so we're vulnerable here.
Why are routine immunizations, which that is one of, why are they so important?
They are the backbone of public health, and they're one of the greatest achievements of medicine in the last 100 years. The estimates are that right now, with all the routine vaccines that are available, 5.5 million deaths that would have occurred due to diphtheria, pertussis, polio, measles are prevented. So these are safe injections that prevent very serious, potentially fatal infections. And right now, there's a couple reasons why we're seeing more and more of them circulating, not just measles, but polio, pertussis last year. One is that, unfortunately, there's a lot of misinformation out there, and it's hard for people to know what is the information they can trust, and there's a lot of misplaced mistrust. So vaccine rates are going down. The other is, and this, again, is kind of we're a victim of our success, these are very serious diseases that, because of the vaccines, we don't see anymore. So before 1963, every kid would have had measles by the time they were 15. But now, because of vaccines, most physicians have never seen a case, which is an amazing achievement, but one we can't lose.
And what would you say to the parent who's on the fence about getting their child vaccinated?
So first, as a mom and as a physician, I would say that I appreciate and I understand the decision they're trying to make out of love for their child. But I'd underscore 3 reasons they should do it. The first is these vaccines are safe. They've been rigorously studied and they're monitored after they're introduced. Even when you're getting multiple vaccines on the same day, and as a parent, I know how hard that can be for your kid, there's a reason why they're getting multiple vaccines to protect against those diseases at that time, and they've been studied. The vaccines are much safer than, well, the diseases are much more dangerous than any possible side effect of any vaccine, which is typically very mild. And then finally, by getting your kid vaccinated, you're protecting not just your child, but all of those around them, including folks who can't get vaccines, newborns who are too young, or people with compromised immune systems.
Dr. Anderson, would there be any need for an adult to get, for instance, like a booster measles vaccine? I don't even know if that exists or not, but is that something you would recommend, or?
So that's a great question. It's an important question. So most adults who were born before 1957, measles was so prevalent, they probably already would have been exposed, and they're probably immune. If they were born between 1957 and 1971, they should probably check with the doctor because the vaccines were kind of evolving then and it's not so clear. Otherwise, they could possibly talk with their healthcare provider. They should talk with their healthcare provider, and maybe they could get their immunity tested.
Oh.
Or these vaccines are so safe, there's nothing to say they couldn't get another MMR vaccine now.
Okay. And one more question for you. This one we're both really curious about. Since measles was wiped out, gone, it's back. Are there any other vaccine preventable threats that we need to be watching out for?
Well, so these diseases are still circulating. Polio, occasionally we see cases in New York State. Pertussis, we had increased cases last year. But one thing I did want to mention, these vaccines are safe and they work. So people may hear in the news that vitamin A, cod liver oil is an alternative cure or prevention for measles. That's not the case. It can't prevent measles infection. The vaccine works incredibly well, and it can't prevent death and disease to the degree that these measles vaccines can.
Great information as always, Dr. Anderson. Thanks so much for being with us.
Thank you so much.
Really appreciate it.